Hello, parents, and welcome to the Parent Guide podcast, your trusted resource for helping your teen overcome pornography addiction. I'm Matt Bulkley, a licensed clinical social worker and psychotherapist with 25 plus years experience in supporting families through these deeply sensitive challenges. Today's episode dives into a topic that's on many parents' minds, and that is navigating debate on pornography addiction versus problematic pornography use, and why early intervention is more important than how we label it. So, as a parent, you might be sitting there wondering, well, is my teen's pornography use really an addiction, or is it something else? And the truth is, the mental health community debates this intensely. Some experts call it pornography addiction, drawing parallels to substance dependencies like drugs or alcohol, where the brain's reward system gets hijacked, and others prefer terms like problematic pornography use, or it's commonly referred to as PPU, to emphasize the context, avoiding the heavy stigma of the term addiction, and focus on how it's affecting daily life without labeling it as a full-blown disorder. And this confusion can leave parents like you frozen in indecision, unsure whether to act now or wait it out, hoping that it will pass. But here's the compelling reality that cuts through all the noise about that. Recent studies just here over the last 3 years, from 2023 through this year, paint a clear picture. A meta-analysis that was published just last year in 2025, it found an overall pooled prevalence of problematic pornography use at around 13% across general populations and subpopulations like students, with rates varying anywhere from 8 to 19%, depending on the region and the assessment tools that were used. And for adolescents specifically, exposure is alarmingly high, as a 2025 study in Europe across 6 different countries reported 54% of teens are exposed to online pornography, with about 24% consuming it at least weekly. And another study from last year as well showed that 90.5% of adolescents between age 13 and 18 have viewed pornography recently, with boys often exposed by age 10 and girls by age 13. Overall, 70 to 80% or more of teens have encountered it, and many experience distress, with prevalence of problematic patterns somewhere between 5 to 14% in the teens who use it. Well, so why does this matter so urgently? Well, the teen brain is still developing. The frontal lobe, prefrontal cortex, responsible for impulse control and decision making. Research continues to emphasize that the brain isn't fully mature until mid-20s, and unaddressed issues can escalate into anxiety, depression, relationship struggles, academic decline, or some cases even suicidality. Longitudinal research, study from 2024, reinforces that acting early prevents these types of escalations and supports overall mental health, fostering long-term resilience. And a study in 2023, a systematic review, linked problematic porn use to higher levels of stress, loneliness, and poorer mental health outcomes in young people. So today we'll unpack this debate with some evidence-based insights and share some real-world case scenarios from my practice, of course, with details being anonymous for privacy, to help spot those key signs that signal a need for help and equip you as parents with actionable steps to support your teen. So if you're worried about your child, then this episode is for you. So stay with me. There's real hope, practical help ahead. Let's get started. All right, well, let's start by clarifying the 2 main perspectives in this debate so you can feel more grounded when thinking about your own individual situation. So I'll break it down step by step, weaving in some of the latest research and a couple of case scenarios to make it hopefully relatable. So first, from the pornography addiction viewpoint, this treats excessive use as a behavioral addiction. Similar to gambling or gaming disorders or substance disorders, it focuses on how pornography can hijack the brain's reward system through massive dopamine surges, that feel-good chemical that reinforces behaviors. And over time, this leads to compulsive behavior and cravings and tolerance. And this is also at that with pornography addiction, that point where teens need more extreme or novel content to get the same effect. And also withdrawal symptoms usually looks like irritability when they try to stop. And neuroscience actually backs this up. Studies over the last few years, 3 years, 2023 to last year, including brain imaging scans, show changes in the frontal lobe and in the reward processing areas, the brain, which are especially vulnerable in adolescence because their brains are still highly plastic and still wiring themselves. For instance, a 2024 review in the Journal of Behavioral Addictions highlighted how repeated exposure can impair executive function, making it harder for teens to focus or to make healthy choices. This model often guides treatments like what we call as CBT or cognitive behavioral therapy, which is tailored for addiction recovery, and things like support groups, recovery groups modeled after the 12-step programs, and sometimes even adjunct medications to help manage cravings. So that would be kind of the support of the addiction direction for how to label it. And on the other side, problem pornography use, or PPU, describes patterns where the use causes significant distress or impairment in life, but without necessarily slapping on the full addiction label. And advocates for this term, which it does seem to be gaining traction, emphasize that it often stems from underlying issues like anxiety or depression or trauma or ADHD related impulsivity or just everyday stress. And here, pornography becomes a maladaptive coping mechanism, a way to escape or to self-soothe rather than a primary addiction. And PPU, problem pornography use, lines with a broader framework like compulsive sexual behavior disorder, referred to as CSBD, which was it was recognized in what is referred to as the ICD-11, International Classification of Diseases, version 11 in 2019, as a persistent difficulty controlling sexual urges that leads to distress or impairment. Just note that it's not a standalone diagnosis in the DSM-5, which is the American Psychiatric Manual of Disorders. And that does keep the debate alive. Recent research, just over these last few years, also reinforces this nuance. This 2024 systematic review that I'd referred to is in the International Journal of Environmental Research and Public Health. Well, it linked PPU to poorer mental health, including higher rates of anxiety, depression, stress, loneliness, and even suicidality. And then a network analysis from studies from last year, 2025, show patterns of escalating use and loss of control while validating instruments like the what's called the PCS, the Problematic Pornography Consumption Scale, across demographics. And importantly, high frequency use isn't always problematic. Context is key. So there was a study in 2020 and then updated in 2024. And replications found that while some teens view porn frequently without issues, others develop problems even with just moderate use if it's tied to emotional triggers. So PPU, this approach favors more personalized treatment. So something that looks more like addressing root causes like co-occurring conditions through therapy or mindfulness or family counseling rather than this one-size-fits-all addiction recovery path. To illustrate this, let me share a case scenario from my practice. We'll call him Alex, 16-year-old boy who started coming into session after his parents discovered his browser history, a lengthy pattern of seeking out pornography. And Alex described starting with curiosity during COVID, actually during the pandemic lockdown, because of boredom. But it escalated to the point that it was daily use and it was interfering with homework. He was losing sleep because he was staying up so late, scrolling and watching porn. From the addiction lens, we saw clear tolerance. Like he sought more intense content and the brain reward hijacking supported by his self-reported cravings. But digging deeper and using more of the PPU framework, we covered that underlying anxiety from school pressure and social isolation was driving the behaviors. So the treatment plan blended CBT, so cognitive behavioral therapy for trying to work on the compulsive aspects of the behavior with therapy for anxiety. And he made great progress without needing to label it strictly as addiction. Another scenario, Ty, a 15-year-old boy whose use was less frequent but tied to trauma from a past family issue. It wasn't so much about dopamine highs, but more about escaping pain. So using the PPU model helped to reduce shame and focus on healing the root cause as opposed to labeling it addiction. And the thing is, both sides have validity. The addiction lens shines a light on the biological compulsivity, while PPU promotes a nuance and avoids over pathologizing the normal curiosity. So the key takeaway for you as a parent, focus on the impact on your teen's life, not just the label. If it's causing distress, then it's time to act regardless of what you call it. How to spot signs that scream early intervention needed. Incorporate more research here and another case to show how this plays out in real life. So the terminology debate, it influences everything from stigma to treatment choices and even your family's sense of hope. Calling it addiction, it can feel heavy and stigmatizing, making teens reluctant to open up due to shame or fear of being seen as broken. And this might steer you towards structured programs like an inpatient recovery or group therapy. And then on the flip side, the PPU feels less judgmental and tends to encourage parents to jump on board with the idea of exploring root causes like the emotional struggles or peer pressure or social factors. And it does tend to lead to maybe a more flexible or individualized support treatment plan like outpatient counseling, and addressing the whole person rather than only the addiction therapy. Regardless of the words, when the use becomes problematic, it can harm emotional well-being, relationships, and development. And parents like you need to prioritize a compassionate response over getting the wording perfect. And research underscores the risks, unrealistic attitudes. And longitudinal studies from 2024 and 2025 on adolescents show strong connection or ties between problem pornography use and emotional and conduct issues like increased anxiety and depression. Prevalence data is pretty eye-opening, really. A study in 2025, it was actually an Egyptian study, found 23% of undergraduate medical students had PPU, problematic pornography use. It linked to lower academic performance and higher stress. And globally, an international sex survey covered 42 countries. This was back in 2024, but it pegged problematic pornography use somewhere in the range of 3 to 16% higher in males and varying by culture. And for teens, widespread exposure. So 93% of boys, 62% of girls, makes early recognition vital to prevent these issues from entrenching during those critical brain development years. Well, parents, here are some clear signs that pornography use has become problematic and warrants early intervention. And I'll expand on each of these with research and tie in a case. So first, loss of control, spending far more time viewing than intended, struggling to stop despite efforts. A 2024 network analysis showed that showed this as a core symptom in about 10 to 19% of users. Second is neglecting responsibilities. And this would look like declining school performance, dropping hobbies, or withdrawing from social activities. Studies link this to poor test scores and fewer study hours. Third, emotional distress, guilt, shame, anxiety, depression, or irritability that's directly linked to the behavior. And a 2024 reviews report actually showed higher suicidality rates in PPU groups. Fourth would be secretive behavior. So hiding devices, lying about online time, or becoming defensive when questioned about it. Fifth would be impact on relationships, pulling away from family or friends, increased conflicts, or more commonly, isolation. And cross-sectional data from 2025 ties this to loneliness and strained bonds. So let me bring this to life with an actual case. We'll call him Jordan, 17-year-old whose parents started to notice that he had become increasingly withdrawn, wouldn't eat dinner with the family anymore, and dropped out of playing sports. His grades went from A's to C's. And when they started to find evidence and they confronted him, and he admitted that he had developed a pornography addiction, was viewing pornography multiple times a day, feeling guilty, but unable to stop. Research-wise, well, this mirrored findings from some of these studies. Well, in this case, early intervention with individual and family therapy helped Jordan to start to rebuild connection and trust, and we addressed underlying stresses which he had started to feel from college pressure. And without the intervention, his isolation could have worsened into a depression. So spotting these signs early, that is your superpower as a parent. It prevents escalation. Studies emphasize that intervening before age 18 cuts in half the long-term mental health risk. All right, so parents, you've got the knowledge now. Let's turn this into action. You have real power to help your teen. And so I want to outline some practical steps backed by research, plus a severe case scenario to show when to escalate support. And remember, early intervention wins because it leverages the teen's brain plasticity for positive change. This longitudinal study actually came out in 2024, but it was a study that went on during the COVID era. It found that teens who received prompt help reduced problematic pornography symptoms by somewhere between 40 and 50%, preventing issues like sexual dysfunction or relationship problems later in life. 5 actionable steps, and I cover these in almost every episode. But number 1, open and non-judgmental dialogue. You've got to be able to communicate about it. Create a safe, shame-free space. Start with something to the effect of, well, I've noticed that you've seemed stressed lately, and I'm here to listen without judgment. And then listen actively. Validate emotions, avoid blames, avoid lectures. There are so many research studies that show open parental communication reduces risky behaviors by 25% or more, strengthening trust and making teens more likely to seek help instead of driving the behavior underground or into more secretive paths. Second, educate yourself and your teen. Learn about healthy sexuality. Learn about pornography's effects on the brain. It's like what we talked about with the dopamine changes and the impact on the prefrontal cortex. And become media literate. Discuss how online content so often distorts reality, how it creates unrealistic perceptions of bodies and consent and relationships. And this builds critical thinking and resilience skills. So, and if you need a structured guide for this, this is where the Recovery Toolbox for Teens can be so valuable. Breaking Free Workbook, which is what your teen would use, Parent Guide for You, and the 101 Tips for Quitting Porn. It's true of workbooks, provides a great structure for approaching these topics in a guided, evidence-based way. Number 3, set clear, thoughtful boundaries. This is where parents, you have to be assertive and exert some parental controls. You need to establish reasonable internet limits, things like device-free zones, time trackers, parental controls, balance with respect. I mean, there is some limitation for privacy to encourage responsibility. There is a greater risk of the addiction beginning to thrive. So research indicates that with some of these boundaries that it reduce without increasing the secrecy. All right, number 4, encourage healthy alternatives. This is where things like promoting sports, exercise, arts, social groups, volunteering, activities that foster self-esteem, real connections, real face-to-face connections, and positive outlets for stress. So it's 2023 meta-analysis linked extracurricular involvement to lower problematic pornography use rates and better mental health. And then finally, seek professional help proactively when it's needed. Certainly there is a time and a place for a parent-led intervention, and sometimes that is all it takes. But if distress or interference persists, then make sure to seek a therapist that specializes in adolescent compulsive behaviors, teen pornography addiction issues. Early therapy is highly effective for internet use disorders, and often through psychoeducation and counseling approaches or CBT or mindfulness. And talked about it earlier, but for structured support, use the Recovery Toolbox for Teens. As I mentioned, it's an evidence-based program based on clinical research, provides teens and their parents with the tools to regain control compassionately. So the trio of workbooks, Breaking Free, which is what the teen works through, Parent Guide, follows same structure as the Breaking Free book. And then the 101 Tips for Quitting Porn is a very practical, easy to implement set of literally 101 tips for quitting porn. Get it in the bookstore at our website, therapyassociates.net. It's the blue toolbox, not the brown one. The brown one is the adult version. Make sure to get the blue one. And in severe cases involving safety risks, like high risk online behaviors, things like chatting with strangers, becoming exploited online, trauma, severe mental health crises, suicidality, self-harm, unmanageable cycles. Or if you as a parent you've just simply lost any capacity to have influence in your teen's life, then you need to consider more intensive options like our Star Guides Wilderness Therapy Program. This provides stabilization, emotional regulation, and family rebuilding in a therapeutic outdoor setting where it becomes the ultimate detox and reset. So, case in point, call him Tyler, 14-year-old boy struggling with problematic pornography use, just tied into some significant struggles with ADHD and some family trauma. Well, his pornography use escalated to some pretty risky online interactions, leading to some anxiety and some potential vulnerability to being exploited online. And parents had tried outpatient therapy. It just was not enough. So Star Guides was the next level of intervention. And through the Star Guides experience, he was able to detox from the addiction, learn some authentic, effective coping skills, and begin to rebuild trust with his family. And the early intervention prevented a worse outcome, which was the result of parents acting promptly and equipping their son to develop a balance in his life with technology use. And it became a great intervention that strengthened the entire family. Parents, I know we've covered a lot today, and just in summary, the ongoing debate between pornography addiction and problematic pornography use as we talked about, the compulsive sexual behavior disorder diagnosis and the ICD-11 and evolving discussions for the DSM. Well, it's complex, but it shouldn't necessarily delay your compassionate action. What counts most is recognizing distress early and responding with love, support, and the right tools. And remember, you can guide your teen toward healthier paths. Research backs it up. Recovery rates with early intervention are over 70%. So start today with a simple conversation or by reaching out to a professional. Change it's not just possible, it's probable. Thanks for tuning in. I know how valuable your time is, and I hope this was helpful. Do me a favor and please rate and review on your podcast app and subscribe for more ongoing weekly episodes on navigating these tough challenges. Links in the show notes for the Recovery Toolbox for Teens, for Star Guides, Wilderness Therapy, and for Therapy Associates, our outpatient clinic for specialized support. I'm Matt Bulkley. Thank you for listening and for the vital role that you play in your teen's life. Keep connecting, keep hoping. I will see you next time.